The background of the case study, Johnny is a 12-year-old boy and he's entering the 7th grade. Johnny's mom, Mary, received a letter from Johnny's school reminding her that he is due for routine immunizations. He's not received a vaccine since his last round of routine immunizations at age 4. Mary decides to refresh her knowledge on routine immunizations. In the process, Mary realizes she has some questions and concerns and opts to speak with Johnny's school nurse for further guidance.
Hi, Mary. I heard that you wanted to discuss, oh, sorry, I should back up. We're going to have an incorrect scenario and a correct scenario, just so everybody's following along with us. Hi, Mary. I heard that you wanted to discuss a reminder that was sent home to parents who haven't vaccinated their kids. I'm really busy right now and only have a few minutes.
Okay, I'm sorry to take up your time, but Johnny hasn't received a vaccine in many years, and I realized when Googling vaccinations, I have some concerns.
Google's not the best source of information. Per the law, all students entering the 7th grade must receive their vaccinations or obtain a waiver. As a school nurse, I'm only responsible to make sure the students have their vaccination filed on time. Looks like Johnny is past due for his Tdap and meningitis. So what was your question?
I understand that you're only doing your job. However, I'm not familiar with the meningitis vaccine, and I believe that Johnny already completed many doses of the tetanus vaccine. So I guess I'm just wondering why he needs more.
Yeah, Johnny did get his DTaP for children, but now that Johnny is 12, he's past due for his first adult dose of Tdap. You can learn more about vaccines from the CDC. But if you don't want Johnny to be protected, you can feel free and just get a waiver.
Well, I do want him protected, but I need to make sure that my questions are answered to make sure I'm making the best decision for Johnny. I'm just still so unclear as to what the vaccines he needs are even for.
Tdap protects against tetanus, diphtheria, and pertussis. Meningitis prevents against the meningitis vaccination or infection.
How is Johnny even at risk for these?
Tetanus is a bacteria in our soil. Pertussis is the whooping cough. Meningitis is a bacteria that is spread through saliva. Basically, everybody's at risk.
Well, I guess I can understand how we all might be at risk for getting sick, but how big of a risk is there?
Let me write down CHOP's website for you. You can go there to look at the risk. I'm really out of time today. Is there anything else that you need?
What is CHOP? I guess I can check it out. I'm just still feeling conflicted about getting Johnny vaccinated.
If you have further questions, you should reach out to Johnny's pediatrician. Just so you know, I need that proof of vaccination or the waiver in 2 weeks. Otherwise, Johnny's going to be sent home.
Well, I was hoping to find out more here, but I guess I'll just need to figure this out on my own. If I get a waiver, how do I do that?
We don't do waivers. You need to call the health department.
Are they going to know what vaccines are required for school? And if I get Johnny a waiver, will there be any restrictions or repercussions for him not being vaccinated?
Here, let me get you a list of required vaccines. Then I really have to go.
Can you tell me if I do choose to get Johnny vaccinated after the waiver, what will happen?
The health department was going to review all that with you.
Okay, I'm still really not sure what I'm going to do. I do not have a lot of time to reach out to the doctor or go to this website. I might just get a waiver to make it easier for me. I'd hate Johnny to have problems if he were to get these vaccines.
Okay, well, the choice is ultimately yours. I sure hope it doesn't hurt Johnny.
So that's the end of the incorrect way. And we hope that what you saw out of that interaction was the school nurse, played by Dayna, being pretty dismissive to Johnny's mom's concerns and not really doing her best job to help educate and provide quality resources for Johnny's mom to get the answers to her questions. So now we're going to go through the correct way to complete that role play. And I will allow Dayna to begin.
Good afternoon, Mary. I'm Sharon, Johnny's school nurse. Thank you for stopping by. I heard that you'd like to discuss the letter that was sent home regarding Johnny's need for additional vaccinations. I'd be more than happy to talk with you. Can you tell me a little bit more about your questions or your concerns?
Hi, Sharon. Thank you for meeting with me today. Johnny hasn't received a vaccine in many years, and I realized when I was Googling vaccinations that I had some concerns. I saw online that there's an option to complete a vaccination waiver, but I'm really afraid of being judged for my decision, and I don't really agree with the government being involved in my child's health care.
I'm so glad you stopped in to see me, Mary. I can certainly sympathize with your worries of being judged and the government being involved in Johnny's healthcare decisions. Would it be helpful for me to share what I know as a registered nurse about routine immunizations as well as the school waiver process?
Yes, I feel like that would be very helpful.
Of course. The role of the school in routine immunizations is to monitor the status of every student on our campus. To do this, we use a system commonly referred to as MICR, the Michigan Care Improvement Registry. This is a statewide immunization system for both healthcare providers and the schools to track and monitor vaccination status. For schools, we are only able to see the required vaccinations in which we will be assessing. Let's take a look at the letter sent home. I'm seeing here that Johnny is due for the next tetanus, Tdap, and meningitis meningococcal vaccine. Per the state of Michigan, all students entering 7th grade must receive these vaccinations or obtain a waiver. Johnny is up to date on all his other school-required immunizations.
How did Johnny get enrolled in that online system? I don't remember authorizing that. Also, I'm not familiar with the meningococcal vaccine. I believe that Johnny has already completed many doses of the tetanus vaccine. Why does he need more?
Typically, the MICRs are created when babies are given their birth dose of hepatitis B in the hospital. I see where that dose was administered. That is most likely where Johnny's MICR was created. There is an option to opt out of MICR if you like. This is something that you want to make sure you tell your healthcare provider. MICR is an important resource to ensure Johnny is protected in case of an outbreak. In terms of Johnny's status, you are correct. He has received his initial 5-dose series of the infant child dose of tetanus, DTaP. Now that Johnny is 12, he is due for his first adult dose of Tdap to ensure continued protection against tetanus, diphtheria, and pertussis. There is a common misconception that tetanus is only at risk if exposed to rusty metals. However, tetanus is a bacteria that lives in our soil, and any deep tissue injury poses a risk for tetanus infection. Pertussis, known as whooping cough, is an important protection for Johnny's lungs, especially during respiratory season. Tdap is recommended for adults to continue receiving every 10 years to boost immunity.
Wow, I was not aware of any of this. Johnny loves playing sports, and he's currently in football and wrestling. Do you think that that might put him at an increased risk?
Certainly, playing sports, especially contact sports like football, would put Johnny at an increased risk for potential injury and tetanus exposure. Contact sports are also an increased risk of spreading meningococcal bacteria.
Oh, really? How is that? I really don't know much about meningitis.
Meningococcal bacteria spread through saliva. With close physical contact, such as football or wrestling, there's an increased risk of being exposed to bodily fluids. With meningitis infection, the meningococcal bacteria can infect the brain and also the bloodstream. These infections can cause swelling, leading to neural damage and sepsis, a life-threatening emergency that happens when your body responds to an infection that damages vital organs.
Wow, those side effects are really concerning. How big of a risk is there for a meningitis infection?
Here, let me share a resource with you that I think that might be helpful. This is the Vaccine Education Center at the Children's Hospital of Philadelphia, called CHOP. Here, you can find many resources which talk about the various vaccine-preventable diseases, as well as their vaccine safety and effectiveness. Let's check out the meningococcal resource together. Here we can see CHOP reports that there are approximately 350 meningitis infections per year, with the annual average death count of around 50 people. Although 350 may sound like a small number of infections, a 10 to 15% death rate is quite high. This page also reviews transmission, vaccine manufacturing, and a detailed description of who should receive the vaccine. What are your thoughts on this information?
It definitely sounds like there's quite a risk for meningitis. However, I still feel conflicted about getting Johnny the vaccines. I'll need to take this information and do some more research.
I get it. It's a big decision to make. I'd be happy to share a complete resource list with you to use for your research. In the meantime, can you schedule an appointment with our local health department to get a waiver for Johnny to continue attending school?
Yeah, I guess I could do that. Do you know how that works and what vaccines would have to be waived?
To complete a waiver, parents schedule the appointment with the health department and the public health nurse to review their child's vaccination history and continued needs. Education resources will be provided for any vaccine your child is eligible for at the time of service. However, only school-required vaccine will be on that form. Together, you and the nurse will determine the reasons for receiving the waiver, such as religion or safety concerns, or an alternative schedule. There'll be a form that is filled in the MICR system outlining the vaccines waived, as well as their reasoning. The waiver will be accessible to the school and also meets the reporting requirements for the student to attend school, as well as the school's ability to receive full funding.
Did you review what vaccines are required for school? And if I get Johnny a waiver, will there be any restrictions or repercussions for him not being vaccinated?
Yeah, so our school-aged required vaccines are hepatitis, also known as Hep B, tetanus, diphtheria, pertussis, which our infant or child doses are DTaP, and our adult dose is Tdap, polio, otherwise known as IPV, chickenpox, known as varicella, measles, mumps, and rubella, MMR, and also the meningitis vaccine, MCV. If there is an infectious outbreak in Johnny's school, he will be asked to stay home for his own protection. This could be days or even weeks long. Apart from an outbreak, there will be no consequences to Johnny's ability to be at school or participate in sports with the signed waiver.
And if I do get Johnny vaccinated after I've already submitted a waiver, is there anything else that I'll need to do?
No, there's nothing else that you need to do. The waiver will cover Johnny for the remainder of time in school through 12th grade or until he receives his vaccinations. It sounds to me like in this scenario, the best waiver reasoning for your situation will be an alternative schedule, meaning you are considering the vaccines on a different timeline than the CDC recommends.
This has been a really insightful discussion. Thank you so much for listening to my concerns and sharing all this information with me. I certainly feel like I have a big decision to make, but this discussion has alleviated a lot of my concerns and made me feel more empowered to make an informed decision. I really appreciate your time today.
Always happy to help. And be in touch. Let us know if there's anything else you wanted to discuss. Have a nice day.
So that concludes the correct or appropriate interaction between the school nurse and the parent. I hope that from listening to both, you were able to see the differences in the way that the school nurse was addressing the parent. She was acknowledging her concerns or her fears. She was providing quality resources and not only just giving the paper or the website to the parent, she was looking at those resources with the parent and helping the parent to understand the transmission and the rates of disease and making sure that all of Johnny's mom's questions were answered before concluding their meeting.